more. Up first, we have Mauro Julka. Mauro is a community organizer with minorities and sub-communities from New York City. His professional interests focus on advocacy, education, and empowerment of gay, bisexual, and Latino communities. Up next, we have Eric Duquillo, who is an LGBTQ advocate. His purpose to educate the public and end the stigma affecting HIV-positive individuals through the use of his YouTube channel. Up next is Jasmine Lopez. Jasmine is the engagement specialist for the Center's Transgender Economic Opportunity Program, addressing the needs of transgender and non-conforming community. Up next is my colleague Elizabeth Rivera. Elizabeth is an advocate and activist community organizer for more than 20 years. Elizabeth is currently the HIV counseling, testing, and referral specialist at the Latino Commission. And then we have Justin Toro, is a licensed social worker currently working as the program manager with the Adolescent AIDS Program, which is housed at the Children's Hospital in the Bronx. So yeah, those are all of our people. And we're going to be starting the questions. After all the questions are finished, we're going to open the floor up to you guys if you guys have any questions for them.
Well, I think that when we're talking about HIV testing, right, we have to think about the outreach strategies. So who are we trying to reach? Where are we going? And sometimes at what time, right? Because if we're trying to reach particular communities, like let's say we're trying to reach high school students, right? What would be the best way, or when is the best time to reach them? During school hours, right after they get out, in after school programs? Because we're seeing that a lot of young people are becoming sexually active earlier, like maybe even as early as middle school, and they don't have enough knowledge about what does sex mean, right? What are the risks that are involved? And because they're so young, they kind of have this mentality like, oh, it's never gonna happen to me. Oh, it just happens to this group of people or this age group. So I think that beginning to get them earlier in different areas and at different times can definitely help with that.
I'm thinking also as well, social marketing campaigns are very important. I find that people connect with what they see if they see themselves in a marketing campaign. And again, like she said, it depends on who you're trying to target. And yeah, I think one of the major pieces for me is social marketing. Most definitely needs to be geared at the community that you are trying to target. It defeats the purpose to talk about needing to do the work within the community when you're not making the efforts to actually do the targeting in the social marketing developments.
To talk about the part of retention and care, you really have to make sure that any agency or clinic, hospital setting is providing culturally competent care. You can't have a provider that doesn't understand Latino culture, religion. If somebody is a part of a certain religion and they're talking about that they hear voices or they speak to certain people, a doctor may think they're crazy. But in still, it's actually part of a religious culture that we as Latinos understand and promote. So if you are having providers, whether it's social workers, nurses, doctors, that don't understand our community, then we're actually at a disadvantage because we're not having all of our healthcare needs met in that setting. And it's completely within our right to leave that doctor and find a doctor that will empower us to be part of our healthcare instead of just coming in, having 15 minutes, and then leaving.
My opinion is pretty simple. If we know the numbers are really high in the Latino community, I would just suggest make sure we have the funds to target the community where they are. Usually, for instance, Bronx, I've seen some statistics and it's pretty scary. So whoever's in charge of that, just make sure that the funds are there so we can do something with it.
Good morning. Well, personally, I believe that acknowledging, like I hear them mentioning, the different ways that we communicate nowadays have changing. Also, the way that we communicate this information to the community has to change too. Also acknowledging just because I'm Latino, when we talk about Latino culture, I'm Latino and I can't even define what the Latino culture is in general. Acknowledges that there's a difference within the Latino community and applying this to these strategies. I think that would be a good way to reach out to these communities. At the same time, also, I think that will help on late testing will be to include these communities. Include these communities that most of the time are oversight, or most of the time are not even acknowledged at all, just because different social factors. New York City is one of the fast growing communities of immigrants. One of the fastest communities that have been changing since 2014 has been the South American immigrants, Latino community. So just acknowledging all these changes and bringing this to the equation, I think that will make an impact on how these strategies are working. I firmly believe that several times when we talk about late testing, that's the end result of something. And although it helps to focus on that problem, I don't think that's going to resolve that problem in general. That's just a solution. So we need to target what is the root cause of these numbers. So, and in terms of care, I think politics play a big part of it. And we can see nowadays that the current president is throwing some mixed messages that actually are confusing and creating some barriers. So I think we need to have a strong base of referrals of information, because a lot of information most of the time just creates confusion. Once you make a decision that you want to get tested, then where do you get tested? I think a lot of times we just focus on the client and just emphasizing that the client is the problem, he's not coming to get tested. But most of the time we don't see what we're doing. And I think one of the big things for late testing is access to getting tested. We know for a fact that a lot of immigrants, and I'm just going to talk for the community that most of the time at work, which is Central Americans, Mexicans, Guatemalan, Honduras, and also South American, a lot of undocumented immigrants, they usually work on labor. So usually they're off, or their availability of time is late at night or in the weekends. So we can see most of the time some policies say don't get tested on the weekend, or it's a few places where you can go late at night. I know a lot of strategies just rely on good intentions, but we can see that sometimes good intentions are not always the best action or the best course. Just to give you an example, when people go, I see a lot of places where they go get tested on the clubs, but sometimes when you go to a club or bar, that's not the first thing that you want to do, And I think also that can stigmatize to get tested. So just that, for testing.
We actually do provide testing during the later evening hours at our program, as well as we do provide testing on the weekends as well. We're open on Saturdays. And we also provide testing at a mobile unit in front of a club. And I have found the opposite reaction, actually, that there are people that are actually welcoming to see our mobile unit there and our services being provided. I think that what we need to really work hard on is destigmatizing the idea of getting tested. Okay, I think it's very difficult for folks to want to get tested when, we're hearing, the messaging that is sounding as though it's not okay to get tested in certain areas. You should be able to get tested wherever you want to get tested if the service is being provided.
So I wanted to add something regarding language. Last year, I think there was a point that was made that language is very important in terms of making sure that people get tested and get connected to care. And it's not just about, okay, you're a monolingual Spanish speaker, so you need someone who speaks Spanish. It's also, you need someone that will be able to communicate what PrEP and HIV prevention means to you. Because the way that you talk about PrEP and HIV testing and HIV care will be different in Hunts Point in the Bronx than what it is in Bushwick, right? And who's going to be able to do that better? A community member that lives and works in the Bronx, right? Or someone who lives in Chelsea and goes up to the Bronx and tries to talk about these things. So it's not just about language in terms of whether you speak English or Spanish or French or Russian. It's also how can you communicate that language within the environment that you find yourself in and the community as well.
And unfortunately they are not accessing this service because of stipulations and laws and policies that deny them the right to this service that will allow them to prevent an HIV infection or to protect themselves. Luckily, within the next few months, we will see changes in that, but you know, just to give an example, we had a young person that was part of the foster care agency system back in August, came to us wanting to PrEP. Unfortunately, the agency did not have medical authority for this young person. 2 months later, they came back HIV positive. So this was a complete missed opportunity to avoid HIV infection. And we know, as you know, our colleague said, young people are having sex at a much earlier age than probably we were having. But if we are not giving them the full access to what is useful to them and what is going to help protect their sexual health and their sexual freedom, then you know we're actually doing them a disservice again. And for individuals and providers and agencies that sex shame, that also needs to be addressed as well. Is, you know, there's this term thought and things like that, and there's such a negative connotation to that. Instead of you know, instead of downplaying somebody's sexual practices and you know, telling them that it's wrong to feel that way or it's wrong to think that way, we need to empower everyone to know that sex is great, sex is wonderful, and I'm pretty sure everybody in this room loves sex too sometimes. So it's empowering anybody to be sex positive because in our culture, you know, I'll even use a nice thing in my family, sex wasn't always promoted as a positive thing. It was, you need to wait till marriage, or you need to wait till you do this, or you need to do that. And I was so not for that, that I felt I was doing something wrong instead of actually giving into something that felt so right and was so right. So it's really making sure that we are coming from a sex positive perspective to make sure that for my population, adolescents, they know that they can enjoy sex because it is natural, it is something that they should be able to do, but how they can do it both safely and smartly.
I will say that for the trans community, at least in my experience, they aren't accessing PrEP and PEP as much as they need to be. Mainly because either the service providers they're accessing aren't competent enough culturally, or the social marketing is not targeting them. A lot of these girls, you know, do survive off of survival sex work. You know, it's difficult to sell it to them when they have all these other myriad of things that they're dealing with, and then you tell them that, you know, they have to take this pill, and this pill may have, you know, some slight side effects, and there's a process that goes around it. There's this kind of fall off, and it's also in the way that we're delivering that message as well. You know, again, it's finding a way of, you know, really, you know, getting to the root of how we're providing the messaging to the community and who we're doing it to.
And I just want to add, well, in my work, I work predominantly with trans women of color around education and employment. And in my work specifically, I've found that they are being able to access PrEP and HIV services, but it's only because we're providing that bridge, right, between not accessing services versus accessing services. And a lot of the time I hear conversations about, okay, we need to make sure that trans women of color are on PrEP, right? HIV testing, HIV prevention, and care. But there's barely any mention of the trans masculine folks. There's no mention about intersex folks. And what about them? You know, there's barely any information that can even begin to address the needs that they have that we don't know about.
I'm not a professional. I can only offer my opinion based on my experience as somebody being positive for at least 8 years. And a lot of people actually, I guess, trust me because I'm positive and they can just ask me these questions. So as far as like the whole PrEP, I have had a lot of questions and a lot of concerns, but I feel like a lot are accessing it. But what I don't think is being addressed is a lot of the side effects, because some of my friends who have asked me about PrEP are the ones that have been skeptical and have not been on it, and they just always bring up the same thing, the side effects. So I guess it is being offered, but maybe the information as far as, you know, what are the side effects and what are the long-term consequences, not so much. PEP, I barely hear about PEP. I don't think that that's been discussed much, even though PEP was way before PrEP. So I think PEP needs to be definitely discussed more. Yeah.
So in terms of PrEP, it would be interesting to find some reports that actually specify among access among race, immigration status and stuff. I don't think there's such report yet since the last presentation that I attended. I hear a lot of people accessing PrEP, but it would be interesting, like I said, to see what populations are accessing. One of the main barriers that I think I found in PrEP as a provider that can share, it would be mixed messages about PrEP. You know, and I think that's a challenge that we've been dealing with providers for a while. Because there's mixed messages. So most of the time clients, when they make the decision to access PrEP, sometimes they can find it a big challenge when they confront these different information just when they're in the right point to access that. You know, just to bring one, for example, PrEP is not free. PrEP is accessible, yes. You can access to that, yes, but it's not free. And just, I think, giving the message that this is free sometimes creates misconception. And there's a process you have to do because someone has to pay for that. Also, PEP is not free either, you know? And I can share the experience that for myself when it was really frustrating just to access PEP when I need it at the moment. So, although I think there's a lot of progress on that, I think providers have to be accountable for that, take accountability for that, because most of the time they are the main barrier for clients to access PrEP. I hear a lot of times, you know, you can talk to your doctor, you can talk to your nurse practitioner and stuff, but the truth of the matter is when you go to a provider, the doctor is not the first person you talk to, or the nurse is not the first person you talk to. Most of the time you talk to staff from the front, and sometimes they also create a barrier for clients. So I believe like a structural information to make sure that also organizations structure these mechanisms so where clients can actually access the right information at the right time will be really beneficial for several communities to access that. I sympathize. I think most of the times that there are certain communities that always prompt with the PrEP information, but I don't hear these discussions for other identities like that were mentioned here, like for the male trans community or for sub-communities of Brooklyn. I think that also will improve access on PrEP and PEP. Most of the time it's sad for me to find out the clients want to learn about PEP or PrEP when there's already been an incident. Most of the time, that's my experience. I think that's what can I share about PrEP.
Times when there's focus grouping and things like that, that there's actually not representation of the communities that their voices are not heard. So I think that's definitely the first step, is making sure that their voices are heard, because they are the content experts. I can't speak as a cis male on the trans male community because that's not my experience and I have no expertise in that. Yes, I may work with that population, but I have not lived that experience and I have not had that type of experience. So in order to, I hate the word target, so I really hope one day we remove that terminology of targeting populations. They're more priority populations, if you will. I'm hoping that one day we will have individuals from those priority populations sitting at these tables and sitting at these focus groups and sitting on community advisory boards and state boards and national boards, so this way their voices are heard. So until we can do that, we are just going to continue having this conversation amongst people who are not living that experience. So until we can actually bring them to the table and have them represented, we're not going to be able to get those answers.
I'm actually glad that you brought up that point, because I think the major impact that happens, it's not just about doing culturally competent service providing, but it's also about hiring us, okay? It's highly important for a transgender non-conforming individual to walk into an organization that's providing a very essential service and not only be able to access a service and receive the service that they're seeking based on their specific, reality, on their authentic truth, but to be able to speak to someone who comes from that experience, being able to speak to another trans woman, to another trans man, to someone who actually they can relate to on that level. I think it's been challenging, I think, for me as a trans woman working for organizations and sometimes hearing somebody say, oh, you're the token trans woman working on stuff. How is that? And the reality of it is that, there aren't enough organizations that are diversifying their staff enough for that reality to, for that stigma to be removed, We are competent enough to do this work. We are competent enough to speak for ourselves, for our communities, for our own needs, if given the opportunity. So historically, the thing that has happened is that our community has become disempowered in some ways because we have not been given that opportunity to become the strong community that we can be. And this is why we continue to see this community fall, to the wayside at time. And again, I go back to, it's not just about hiring us, it's about doing competence. So don't speak to me and tell me, oh, we have these services. I want to see you do the work. Actions speak louder than words. Actions speak louder than words. I need to see you put in the work. I don't need to hear you say you're going to do it. I need to see it happen. And I think that's been the frustration from the trans community as a whole, is that we keep hearing, this is what we want to do, this is what we want to do, yet we're not seeing it happen. Okay.
Thank you. I want to further expand on representation and making sure that other communities' voices are heard. And one of the ways that we can begin to do that is to assure that we have correct data collection. Because up until recently, one of the main reasons why we were able to even gather, data on transgender women was because we finally realized, oh wait, we're not supposed to be putting transgender women as MSMs. So when you think about transmasculine folks, are they lumped in as women that have sex with, men or with other women? What about intersex folks as well? Where do they fall? Do they fall into one of those other categories and they just kind of get lost to that so-called translation of that data collection? I think when we begin to address that, we'll be able to see that there's a lot of need that we were ignorant to before and we just completely overlooked.
You know,
I honestly don't think so. It's a very straightforward answer. I honestly don't think so. I've never seen like a Spanish language forum or panel talking about ending the epidemic by 2020. And I think it's important to have those spaces there because we need to call in and hold the Latino community accountable as well. They need to feel and recognize that they're a necessary part of this conversation. And I also want to add that in all this talk about ending the epidemic, every single time that I hear about, people living with HIV, making sure that they get into care, the first and foremost is always, to get them, to a low viral load so they don't pass the virus to others. But what about them actually being healthy? What about the support that they need, constantly? Because some things are going to be harder than others, I'm sure. I'm not positive, but I'm trans and I know that some days are harder than others. So probably living with HIV, it's probably the same way. There's daily reminders that, you're living with this. So I think that just as a whole, right, to understand the epidemic and ending the epidemic, we have to make sure that we have to destigmatize what it means to live with HIV. And we have to begin to look at HIV and people living with it as, okay, these are people who are living with an infection that needs to be treated, and not people who are just carrying a virus and we have to make sure that they don't pass it to other people.
This actually brings up a perfect point, is that we've failed in our community because unfortunately there have been forums, but obviously nobody's heard about them. So that means the promotion, the execution has not been successful, and that is hopefully a call to action that we need to do a better job at promoting this and making sure that these types of forums are available. But it's not only our communities, as Latinos or not as the trans community, it's also, populations that aren't these prioritized populations, as the Asian community, the South Asian community, the, Caucasian community. If we're on a path where HIV treatment is for all because no one is exempt from becoming HIV positive, then we need to mirror those images the same way we are doing for targeting HIV prevention. It needs to be prevention for all. Because when we prioritize men who have sex with men, we're losing on those heterosexual identified individuals. If we are only identifying trans women, we're now losing trans men. So unfortunately, when we hone in on one population at a time, we are then forgetting about everybody else that is at the table or that should be at the table. So instead of, again, this word targeting, instead of targeting one population, we need to learn how to message for all, but relate to all at the same time. Is that, my experience is going to be very different from anybody sitting at this table. So we need to make sure that a message that works for me might also work for them, and vice versa. It's difficult to do, but guess what? That means we have to start working harder. And we need to make sure that in 3 years, because we are 3 years away from 2020, that we are going to make this mark. And if we don't, what is that going to do for us as a state? What happens if we fail? I think that conversation has not happened at all. I think all the resources have been pushed into this into the ending the epidemic, and I am hoping and I am so for that it's going to happen, but we need to start thinking about the what ifs. What if this does not happen? What do we do then? What happens when 2020 rolls around and we do not reach this number? Does that mean we failed, or does that mean we pick up and we work a little harder? So it's really about making sure we're being inclusive of all populations while knowing that there are certain populations that need a little bit more support, a little bit more prioritizing. But again, once we start doing that and once we start singling out communities, we are now forgetting about the other communities that are just as important.
Just briefly, I think this is a great initiative, and actually it's a milestone for the state to have, from the top down, initiative to actually target strategies to end the epidemic. However, like any strategy, I think it has loose ends, And that's, I think, our focus should be as providers to focus on that. How can we improve that? Because we might not get the result that we're waiting for 2020, but I think it's a great start to political initiative to congregate all organizations and also the government into be a part of the solution that's going to be for the good of the community. So yeah, and I think I attended one forum, but one of the things that wasn't seen there is inclusion. Inclusion, and I think that's a great challenge, especially in big cities like New York. That diversity is such diversity, such different type of culture that sometimes it's hard to reach everyone. So I think culture plays a big role in how we deliver information and how information is processed. So we need to include this. We need to include this because it makes a difference. Also acknowledge that communication is changing. Just to give you an example, a lot of people don't even answer the phones now, they use text. You know, the young generation most of the times are on social media. Although we come, I'm from 1982, so I come from a generation where we didn't even used to text, you know, we didn't even have phones, cell phones, you know, so I know a lot of people can relate to that, but it's amazing how people process information and how this is so rapidly changing. So these have to play a part on how information is being processed. You know, so all these several loose ends might be have to be considered to target such powerful initiative, and hopefully someday we can. This can be something of the past, something that we can learn to target other diseases.
I think what's also important is that sometimes we get stuck in a box, and we are not challenging ourselves to step out of that box. Step out of your boxes. Get creative with your messaging, get creative with your approach. Hey, don't be afraid to get sexy with it. It's okay. I think that one of the things that I've experienced or I've observed has been that a lot of organizations have shied away from being sexy or provocative with their messaging to appease the conservative funder. And what you're doing is you're losing the interest of the populations that you're attempting to connect with. You're no longer speaking to them anymore. You're just speaking at them. And, you know, for me, well, one thing that I enjoy is being able to look at an advertisement, you know, and see that, you know what, you went there with it. Thank you. You know, you pushed the envelope. You got my attention. You know, it works. I think that when you start streamlining and you start trying to get corporate in your ideas of the way that you want to connect with the community, you're definitely going to start losing the interest of the community.
The medication that they reach viral suppression. I think first we have to empower the HIV positive community. I think a lot of times the goal is just, like I believe Elizabeth or Jasmine had said, let's just get them undetectable. We're just numbers, and we need to get empowered with that. And also, if we really want to get to that 750 number, ending that epidemic, I haven't heard anything about the crystal meth epidemic. And it's absolutely terrifying. I see it almost every single day on Grindr, Chat, Craigslist. The only organization I've heard this talk about is ACT UP, which I love. So I would love if ACT UP would somehow talk to everybody else and try to address the crystal meth epidemic because it's really bad. That's all.
Do you have a question, anyone? Oh, good.
So I just have a comment. Thank you so much for the information. But at Mount Sinai, I know
in the city level, also that we need to get more work with the young people and over 50, more culturally responsive work that's meeting their needs, also culturally responsive work for Latinos. But I also want, in the spirit of Ms. Rivera, I want to ask you, what are some out-of-the-box strategies, and for Mr. Trujillo also, that because crystal meth and substance use is so highly stigmatized, how can we work with these populations? What are some ideas that if you had the opportunity to create interventions or some sort of work or social marketing campaign, what do you think would engage that population?
As far as crystal meth, I see it every day on Grindr, Jacked, Adam, and especially Craigslist. And I think a lot of these applications and places where hookup apps or whatever you want to call them are not being I guess prioritized, not targeted. I think maybe some sort of advertisement where there's, support groups for meth addicts, meth addiction. Just so that they at least see that message, and also, I don't want to say we would have to flag them. Like, I know I report every single time I see capital T or clouds or whatever. But yeah, basically go where they are, and I know that the way they communicate is through their Craigslist especially.
Interestingly enough, I actually picked up some crystal meth flyers yesterday at an event that I was at to bring back to my organization to have a discussion with my supervisor about starting to create, social marketing material, blah, blah, blah. Anyways, but as I'm sitting here, I'm also realizing I just literally had a conversation with a young man 3 days ago on Facebook who I responded to his post. He said that we aren't having enough conversations about crystal meth use. And I told him, actually, yes, we are. There are forums out there, there are support groups, and he's like, well, why am I not hearing about them? And I kind of got stuck on stupid. Didn't know how to respond to him, because that is real. Here's a young man basically telling me, I'm not hearing about it, and I think that crystal meth is real, not only in the gay male community. I know trans women that use crystal meth. It's a real thing. And I think also it's about maybe creating a documentary project or doing some type of web series or doing a really disconcerted effort to really do, again, a social marketing campaign focusing on crystal meth use amongst the trans and gay male population. Again, stepping outside of the box. I can't stress that so much. I don't know if you've noticed me, if you've actually taken a good look at me. I'm a pretty alternative girl as it is already. I'm not your, I'm not into, I'm not very vanilla, let's put it that way. I am a girl that lives outside of the box every single day of my life. And I think that that's what allows people to kind of connect with me a little bit more, because they're like, there's something about her that I want to know and connect with, because she lives her life to a different beat of her drum. And that's the way that I lead my work, is to a different beat of a drum, okay? I'm not trying to do it the way the CDC necessarily, I'm not putting down the CDC, but I don't necessarily identify as an MSM. And when I continuously, I get frustrated, when I feel like we're in 2017 and I'm still finding out that you're putting me in that box that I don't live in on a daily basis. Yeah, there's a huge barrier there. Get out of the box. Get out of the box.
Thank you, Elizabeth. I want to celebrate you. I prefer Rocky Road over vanilla any day. Do we have any other questions? Yes, please. I want to thank you all for being here today. I think, there are amazing efforts to end the epidemic in New York City and statewide, especially for Latinos, but we cannot ignore social determinants of health that are perpetuating these disparities, such as poverty, education attainment, immigration status, and whether people are naturalized or not naturalized, all those issues, right? Those play a role